Hello.
Dr. Fred, good afternoon.
Yeah, hi, good afternoon. How you doing?
I'm fine, thank you. Yes, so we'll just wait for like 5 minutes for a few more people to join before we now get started. So it's just 5 minutes to 4, so by 4 o'clock we'll be ready to get started.
Okay, no problem.
All right, so let me just share the link while we're waiting for people to join. Sorry, please give me another 1 minute. So try to get some. Seems like the guest has left again. Okay, yes. So I think we can get started now. So good afternoon, everyone, and welcome to today's live video. Today is basically going to be about cervical cancer awareness. You know, it's Cervical Cancer Awareness Month, which is January, and then we have our host here with us, who I'm going to introduce shortly, who is going to be taking us on our cervical cancer awareness for this month. So let's just get started right away. Just, hold on a second. Yes, so with us here, with our host here is Dr. Frederick Unubukai. He has 8 years of medical practice experience, graduated from the College of Ambrosali University, Ekpoma, Edo State, and had his 1 year housemanship at Specialist Teaching Hospital. He worked as a medical officer at the new Ayetoro Medical Center and is presently the company doctor of AIM Group. He's passionate about public health. He's a public health advocate, and he is almost done with his master's degree in the same public health. And of course, he's active on social media. Some of you may know him and as Dr. Fredusta. Yes, so Dr. Frederick, please, you may have the floor now. Welcome. You may have the floor now.
Thank you very much. Good afternoon, everybody. Good afternoon, Joy. Thank you for having me. I'm happy to be here to talk about something very interesting today.
Okay. Yes, so we are basically talking about cervical cancer this month. This is the month for it. So I'll start by asking you, what is cervical cancer?
Thank you very much. Cervical cancer is a cancer that affects the cervix, but it would be nice we talk about cancer. What is cancer? Cancer simply means abnormal cell growth. Every part of the body, you have your cells in that part of the body. So when the cells in that part of the body becomes abnormal, those cells have developed or have now become cancerous. When this affects the cervix, so we call it cervical cancer. Now, the cervix is located at the region between the uterus and the vagina. That is where we
Oh,
find the cervix. It's seen in women. I don't want to break it too deep, not to confuse us, but there is a connection between your vagina and the cervix and the uterus. So the cervix is at that point, like the junction, like the door that keeps the uterus closed. So when that area becomes affected with cancer, we say the woman has developed cervical cancer. It doesn't affect men though, just women. It's quite a very bad, let me use the word bad condition because it has led to so many loss of lives and it's a preventable and treatable medical condition, especially if diagnosed very early. However, so many women are not aware, despite so much advocacy, so much discussion on cervical cancer. That is why I'm happy that we are having this conversation again today.
all right. Thank you for that. So what are the signs and symptoms of cervical cancer? What should a woman look out for? What changes should a woman look out for in her body to know that there may be chances of having cervical cancer?
I feel instead of we talking about signs and symptoms, maybe we talk about like the causes, right? Or maybe the risk factors because people want to know, okay, what causes cervical cancer? I think that will be better before we now talk about the signs and
Signs
symptoms
and
of cervical
symptoms.
cancer. Yes.
Okay.
Okay. The common cause of cervical cancer is a virus called the human papilloma virus.
Okay.
Now, this virus, I'm glad we're having this conversation. This virus has so many subtypes or serotypes. To make it simpler for everybody to understand, we say maybe it has so many family members, this human papilloma virus. So many of them. It has the 16, type 16, the 18, 31, 35, so many of them. The common cause of cervical cancer is usually caused by the human papilloma virus type 16 and 18. So
Okay.
most people develop cervical cancer, most women, from the human papilloma virus. And how is it gotten? The human papilloma virus is gotten through sexual intercourse. It is said to be among the commonest sexually transmitted infection, the human papilloma virus. So, for every individual who has had a sexual intercourse, you are at risk of coming in contact with the human papilloma virus. But it's interesting to note that not everybody who comes in contact with this virus will develop cervical cancer. Not every woman that comes in contact with the human papilloma virus will develop cervical cancer because along the line, the immune system tries to clear this virus. About
Okay.
70% of the time, the immune system can actually clear the virus. But in some other cases, this virus can lead to chronic infection, whereby the body can no longer clear the virus. the virus now stays in that region for a very long time and then leads to cervical cancer. So the commonest or the main cause of cervical cancer is due to persistent or chronic infection with the human papilloma virus. This virus
Okay.
is gotten through sexual intercourse. Now, I mentioned that we have different serotypes of this virus: 16, 18, 35, 31, and so many more. This virus also causes other forms of cancer. The human
Hmm.
papilloma virus, it causes cancer. It also causes what we call warts, genital warts. But the human
Okay.
papilloma virus causes other types of cancers. It causes penile cancer, vulvar cancer, vaginal cancer, anal cancer, oral cancer, oropharyngeal cancer. So when we talk about the human papilloma virus, this virus causes a whole lot of problems. But for cervical cancer, the common cause of the cancer is due to the type 16 and the type 18. Now, what could also increase the risk of a woman coming down with cervical cancer? Number one is an infection with the human papilloma virus. Number two is having multiple sexual partners. So
Okay.
someone or a lady who has more partners increases her risk of coming down with the virus. A lady who started engaging in sexual intercourse at a very young age increases her risk of coming down with this, of getting in contact with the human papilloma virus.
Okay.
Also, women who smoke. Research has shown that some of the byproducts of smoking can be found within the cervical region, the cervical cells. And this byproduct affects the DNA of the cervical cells. So women who smoke increase their risk of developing cervical cancer. Also, smoking has been known to affect the immune system. Therefore, women who smoke tend to suppress their immune system. In this regard, the immune system can no longer clear off the virus.
Okay.
Also, on the immune system, people who have weakened immune system might come down with problems associated with cervical cancer or even the virus, because we know that the immune system clears this virus. So when you have a problem with the immune system becomes weakened or suppressed. In cases of HIV infection, you know, HIV affects the immune system. Or you have a woman who is on medication, immunosuppressants. Maybe she has autoimmune diseases, an autoimmune disease, or she's on steroid for whatever reason. Some of our people are in this habit of self-medication. Some of them could also be on steroid, and steroid is said to also suppress the immune system. So any woman who has a weakened immune system might come down with cervical cancer. Another risk factor, or a factor that increases the risk of a woman having cervical cancer, is multiple pregnancies. Because for every time the woman gets pregnant, she engages in sexual intercourse, and this also increases her risk of getting in contact with the human papilloma virus. These are some of the risk factors for cervical cancer. We mentioned the virus, we mentioned sexual um, encounters, we mentioned lifestyle such as smoking, we mentioned pregnancy. And then again, one very important one, the type of infection too with the human papilloma virus. Remember, we mentioned type 16, type 18, type 31, type 35. If a woman gets infected with a very high risk type of human papilloma virus, the type 16 and the type 35, she stands a higher risk of coming down with cervical cancer. It's also important to note that when a woman gets infected with the virus, she doesn't come down with cervical cancer immediately. It takes at least 10 years for an infection with the virus and then coming down with cervical cancer.
Wow.
10 to 15 years, yes. So
That's a
that
lot.
people would not say, "Oh, I've had intercourse last week. I think I have HPV, and then I now have cervical cancer." No, It takes a whole number of years. This
At least
period, he said,
I said at least a decade.
yes, at least a decade. Now, this period gives the cervix time to change. As we discuss, we'll find out that talk about the screening. This is why screening helps us to discover those changes before the development of cervical cancer. So the first, second, third, fourth, fifth, sixth year, the cervical cells gradually change. They gradually experience certain changes, which could be picked or can be picked during screening. So the minimum is about 10 years from infection to the development of cervical cancer. Sometimes it could be up to 15 years, and then also depending on the immune status of that woman. So a woman with good immune system, competent immune system, might not even come down at 10, 15 years, maybe 20 years later. But a woman with a weakened immune system might come down with the cancer earlier than others. And therefore, smoking too, women who smoke are twice as likely to develop cervical cancer than women who do not smoke. Now, going to your question, where you asked about the signs and symptoms of cervical cancer. So we have what we call early symptoms and then
Okay.
late symptoms. Early. It's very important we hear about these early symptoms and late symptoms. But most importantly, again, there might be no symptom at the very early stage. There
Okay.
might be no symptom. And this is why we say that when a woman starts developing symptoms, it means that it has already gone far. The cancer has already gone far.
Done.
What are these symptoms? The early symptoms. We notice symptoms like bleeding after sex. A woman
Okay.
meets her partner and then she notices blood after intercourse. Could be a sign. Or what we call intermenstrual bleeding. The woman sees her period. It's not yet time to see your period again. You see blood,
God.
or what we call postmenopausal bleeding. A woman has attained menopause, so she's no more seeing her period. And then suddenly she starts seeing her period. This could also, she starts seeing blood, and then she says she's seen her period. This could also be sign of cervical cancer. Another one again, another sign could be discharge. This discharge could either be watery discharge, could either be mucus discharge, or could be smelly discharge. So a woman notices she has discharge that is watery, smelly discharge, or blood in the discharge. This could also be a sign of cervical cancer. Again, she
Okay.
might also develop abdominal pain. After meeting her partner, she says, I have pain after intercourse. I'm always having abdominal pain after intercourse, lower abdominal pain. This might also be a sign of cervical cancer. And then now for the late stage, the late stage simply means that the cancer has gone far, and these symptoms, in conjunction with the early stage symptoms, she might have pain using the toilet, going to the toilet. She might have bleeding when she goes to the toilet because these cancerous cells, they have migrated. We say they have metastasized. They have moved from the region of the cervix to other parts of the body. So when these cancerous cells move from that cervix, they could move to the rectum, the area of the
Oh,
anus. And then when she goes to the toilet, she might see blood when passing stool. And this is why we always advise people that when you see symptoms like this, it's not enough for you to sit down at home, hurriedly go to the hospital. She might also notice pain when she's urinating, or she might even see blood when urinating. Other symptoms could include leg swelling. Woman could notice that her legs are swollen. Oh, because there's a drainage, lymphatic drainage. So the lymph node in that region that supplies the lower limb, the legs, can become obstructed, and then the limbs get swollen. Sometimes, too, these women might develop back pain. And we hear people say that I'm having back pain, and then they tell you this common word they use. They say you have jedi jedi, or they say you have eaten too much sugar. That is actually not correct. Back pain could also be a sign of the late stage of cervical cancer. And some women might also feel heaviness in their abdomen, like you feel pressure, weight in your lower abdomen. And then some other late stage symptoms, the woman might also have weight loss. She might look emaciated. These are some of the late stage symptoms of cervical cancer.
Okay. 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 Thank you very much for that. That was quite educative. So, I would also like to ask, what can cervical cancer be genetically transmitted within families? Like if a parent or grandparent, a mother or grandmother or auntie or sister has it, is there a possibility that another member of the family born into that same like family would have it as well?
Okay, very interesting question. Okay, first of all, we know that the most common cause of cervical cancer is due to the virus, human papilloma virus, and this virus is gotten through sexual intercourse, sexually transmitted. In science, there's something we use, the term we use, you never say never. Now, there's a very rare form of cervical cancer that is connected to genetics. You understand? Genetically transmitted. But what we say is that a woman who has a family member with cervical cancer, she's at risk. That is the word we use. She is at risk. We are not saying that because her mother developed cervical cancer, she will surely come down with cervical cancer. However, this woman is at risk of developing cervical cancer because research has also shown that some of these women, they do have a form of genetic abnormality in the area of the cervix and clearing of the human papilloma virus. There's also a very rare condition, a syndrome, PJ syndrome. PJ syndrome. It's called Pus-Jagger syndrome. It's a very rare condition too. People who have this syndrome um, have a very high chance of coming down with cervical cancer. This this condition also tends to run in families. This is why we say that you can never say never in medicine. But we know that more than 90% of cases of women who develop cervical cancer, they are gotten through the human papilloma virus and through sexual intercourse.
Okay. All right. Thank you for that. So, what's the percentage of Nigerian women that have cervical cancer or that develop it often?
Okay, and the data on cervical cancer, a report, a WHO report last year revealed that about 12,075 women um, came down with cervical cancer. And out of these 12,000, about 7,900 women lost their lives due
Oh wow.
to cervical cancer. 12,000 came down with, were affected, while about 7,965, yeah, women lost their lives. It's said to
That's
be the
about
fourth, yes, from cervical cancer. It's said to be the fourth most common cancer in women globally. But in
okay.
Nigeria, it's the second most common cancer in women between the ages of 15 and 44 years. The common cancer between the ages of 15 and 44 years in women. These are some of the statistics we have about cervical cancer in Nigeria.
Okay. How can it be prevented?
Cervical cancer is very, very preventable. Very, very preventable. And one way of preventing cervical cancer is through the use of vaccines, vaccination. The Federal
Okay.
Ministry of Health in Nigeria, through the National Primary Healthcare Development Agencies and their partners such as WHO, partners such as UNICEF and Gavi, have made it mandatory right now through in the immunization schedule of Nigeria that the girl child between the ages of 9 to 14 get vaccinated. What it
Okay.
simply does is that this vaccine prevents these young girls from getting the virus. We believe that at that age, they have not been sexually exposed. So when you vaccinate your girl child, you reduce her risk of coming down with cervical cancer later on in the future. And these vaccines actually protect these girls from the two very common strains of the human papilloma virus, that is the HPV 16 and the HPV 18. Remember, I mentioned that we have other strains of human papilloma virus, but
Yeah.
these vaccines majorly protect the girl's child from the two very common strains that lead to a high percentage of women developing the human papilloma and cervical cancer. That is the 16 and the 18. So we prevent cervical cancer right now with the use of vaccines, and these vaccines are free. This is why we encourage parents and guardians to get their girl child vaccinated with these vaccines.
Okay. All right. Thank you for that. So what would you say are the treatment methods of cervical cancer? And what do you suggest that a woman does when she notices these irregularities and the signs and symptoms of a possible cervical cancer?
Okay, for women, the first advice would be to get yourself screened, not to wait um, till you notice these symptoms. It's not advisable that a woman needs to experience these symptoms. We don't want her to experience the symptoms at all. The best advice would be for the woman to get herself screened. And this screening entails what we call cytology, pap smear, or the HPV testing. So when you carry out this screening, you look out for abnormal cells within the region of the cervix, or you check for the presence of the human papilloma virus, first of all. Now, when a woman notices she has these symptoms, the best advice for her is to present to the hospital and speak with a medical professional, most likely a medical doctor. The reason for this is that there are other medical conditions that could also have same symptoms. Example, a woman begins to develop, let's say, pain when she goes to use the toilet or when she urinates, she notices pain. This pain could be from a urinary tract infection too. And what we've noticed is that most times, women, young ladies, they self medicate with antibiotics. And when they are presenting to the hospital, they are presenting at the late stage. So we advise women to always present at the hospital whenever they notice any of the above mentioned symptoms. What are the treatment modalities? There are various treatment modalities depending on the stage of the cervical cancer. We have
Okay.
early stage and then we have late stage. And then in management, there are different stages: stage one, stage two, stage three. This talks about if the cervical cancer is still within the region of the cervix, or if the cervical cancer has spread to the immediate environment, or the cervical cancer has spread to the lungs or to the brain. So there are different treatment modalities. These range from surgery. A woman could have surgical intervention on her. Some women could have chemotherapy, the use of certain medications that target the cancerous cells. Some women, in certain cases, they may also benefit from radiation therapy. And then new forms of management include what we call immunotherapy, the use of immune cells that target specific cancerous cells. So the management of cervical cancer um, cuts across many factors. Number one, the stage of the cancer. Number two, the health status of that woman. Number three, the fertility potential, the fertility um, outcome for the woman too. Some women will be like, "Oh, I'm still hoping to get pregnant. I still want to give birth in the future." So this would affect the line of management of cervical cancer in the woman.
All right. Okay, thank you for that. So, do you have any scenarios or case studies from research on possible cervical cancer patients or anything in that line?
Well, there are multiple cases, multiple cases. One common case scenario would be a woman in her 40s or maybe in her 50s. Let's say a woman in her 40s. She comes to the hospital to see her doctor, and then her complaints were, "Doctor, I'm not eating, I'm having weight loss, and I'm having abdominal pain, weight loss, not eating, and abdominal pain." And then during discussion, you ask the woman, "How long have you been having the abdominal pain?" And she tells you, "This abdominal pain has been on and off, on and off. This pain has been with me for a long time, let's say 5, 6 years." And you ask the woman, "Okay, what about this weight loss?" And she tells you, "Oh, the weight loss just started like 6, 7 months ago." And then you find out that, "Okay, madam, what have you done? What have you taken?" And she tells you that, "Oh, I have been taking blood tonic, I have been taking supplements, I have been taking um, antibiotics." These are the stuff that our people do. Now, I will tell you why I mentioned this. So when this woman took antibiotics, according to her, lower abdominal pain, because lower abdominal pain could also be due to pelvic infections in women. You understand? So she kept on taking antibiotics, and we know that one other risk factor for cervical cancer is the presence of other sexually transmitted infections like chlamydia. So this woman could also have maybe another STD. You understand? So she has been taking antibiotics, and the abdominal pain is still there. And she feels like, "This is my problem, this is my sickness." And along the line, she now develops weight loss. Now, this weight loss um, might be due to advanced symptoms, like we mentioned earlier. Now, what did she do? She went to the pharmacy to take blood tonic and supplement, because people tell you that when you're losing weight, oh, you can take blood tonic to stimulate your appetite, or you take other stuff to help you. And then when she came to the hospital, she was examined, lower abdominal pain examined, and then, in medicine, we must examine a woman also. So when they examined her, they looked into her cervix and they saw abnormal changes in the cervix, and took her for more tests. Took a blood sample from her, blood sample because she has weight loss, and what again? Also because of the recurrent low abdominal pain, she had scan. You understand? These are tests you do to check out other factors that might be causing her symptoms. And along the line, they noticed that she developed, or she has cervical cancer, the late form. The late form being that this cancer has metastasized and spread to other parts of her body. So this is just one of the case of cervical cancer. There are so many cases. And one thing we know again is that most women present very late. I don't know, we might see more of this in this present time because of social media. A lot of people want to get their treatment on social media, and there is this campaign and discussion we keep having that social media is just a place for you to get informed, not for you to get treated. We see a lot of people looking for medications on the internet. The internet, in most cases, I mean the word in most cases, would end up mismanaging you. And by the time you present to the hospital, you might be presenting with complications. And that is what we keep seeing. This is why we are advising and appealing and campaigning that women get themselves screened for cervical cancer.
All right, thank you for that. You see a lot of scenarios where people just go online. That's both gender now. They go online and they're like, oh, okay. They would prefer to just take advice from the general public rather than actually going to an actual hospital to see a doctor or a specialist or someone that would manage them. So, at the point at which people present themselves, let me say late, so to say, is there any possibility of them actually making it when they are, let me say, presenting themselves late with the treatment and all of that?
Okay, very good question. It's tied to so many factors. So many factors. It's tied to the stage. is tied
Okay.
to also the health status of or the clinical state of the woman when she presents at the hospital. So a woman
Okay.
presenting at the later stage, let's say stage 3 or stage 4 with metastasis, depending on the type of treatment she receives. You understand? Yes, she might, but when we might not be able to use the word cure at this point. What we might be able
Oh,
to use might be manage. You understand? Life expectancy. That is what we say. Oh, okay. What is the life expectancy for a woman with late stage cervical cancer, and what about a woman at the very early stage? So women who present at the very early stage, there's a possibility of total cure for them. You understand? So we say it is preventable and treatable when diagnosed early. When presenting very late, you can't confidently use that word anymore and say that you can cure the cervical cancer. Rather, this is when you now hear the doctor saying, okay, maybe within the next 5 years or within the next 7 years, and it's a very bad state.
okay. Okay. All right. Thank you for that. So, you mentioned about the HPV vaccine and then the pap smears. So, what's the age range of the people that can do it, or can girls of just any age or women of just any age do pap smears and HPV vaccines?
Okay,
Get it?
for the vaccine, because of the immunization schedule in Nigeria, the age for vaccination is between 9 to 14. But that does
Okay.
not mean if you are above 14, you can't get vaccinated. No.
Okay.
You can still get vaccinated even up to 44, I think 44 or 45 years. You understand? You can still get vaccinated. But that vaccination would now be on you. You would need to bear the cost of the vaccination. It won't be free under the government program.
That is-
You understand?
If you are
Yeah.
above
But
14, right?
yes, yes. But what we know is that 9 to 14 is free. So if you get your girl child vaccinated at that age, you are not paying a dime. But if you are above that age and you want to get vaccinated, sure, you can get vaccinated. Remember, we have other strains of the virus. Remember, there are other strains of the virus that are out there. And we're still going to give these women, even though some of these women might have been exposed, this protection might not be 100%, but we also believe that it stands a chance of still giving them little value. And then you asked about the age for screening. So what we say is that from the ages of, I've seen a school of thought that said from the ages of 21 and above, you can get screened. And that school of thought says 25. From 25 and above, you can get screened. Now, the frequency of screening, it could be every 3 years or every 5 years, or depending on the findings of your screening. So when a woman goes for the screening and she's fine, they'll tell her, oh, fine, you are good to go. We will not see you until the next 3 years or until the next 5 years. But if she
Okay.
comes for screening and there's an abnormality detected, sure, she will be sent for the next level of care, and then her own screening might be different from the regular 3 or 5 years screening.
Okay. All right. Okay, so we have some questions here. Okay, yeah, but before I uh mention questions I have here, I'd like to say what's your last word to the viewers?
My last word would be to anyone listening to me, whether you are a man or a woman, we can defeat cervical cancer. There are some things that should not kill us anymore with the level of knowledge we have right now, given to us by God. There are some things that we can actually defeat, and cervical cancer is one of them. So wherever you are, you have a woman in your life, encourage her to go for cervical cancer screening. You have a girl child, ensure she gets vaccinated so that we prevent these cancers affecting us and taking the lives of women, our dear women in this part of the world or in the world generally. So my advice would be if you're listening to me, please get yourself screened, first of all, if you haven't, and get your girl child vaccinated with the HPV vaccine.
All right, thank you very much, Dr. Fred. So I would like to ask if anybody watching has any questions while I ask some of the questions that I have here. Um, okay, hold on, please. Okay, so the only question that's been asked here that hasn't already been answered would be I would like you to explain more about the way forward in managing cervical cancer. Would it just be just the treatment, or is there does there have to be some form of lifestyle adjustment in terms of food or any other thing?
Okay, very, very good. Let's talk about the lifestyle right now. Lifestyle
Okay.
adjustment would be, remember we mentioned smoking. We encourage everyone to stop smoking. Smoking actually has no benefits. The dangers of smoking are massive. With regards to cervical cancer, we know that a woman who smokes, her chances of developing cervical cancer is twice more than those who do not smoke. So this would be one of the lifestyle modification. And another one would be multiple sexual partners. We encourage ladies with multiple sexual partners to stop. Another one would be regarding the immune system. You know, a lot of people don't take care of, excuse me, a lot of people don't take care of their immune systems. And then we notice that when the immune system is weakened, and the chances of the immune system clearing this virus is low. These are some of lifestyle changes that might be encouraged. You understand? Now, for the management of cervical cancer, it hasn't changed much. What we know is that recent discovery talks about immunotherapy and the rest. What we try to avoid is developing the cancer. You understand? We don't even want a woman to develop that cancer. Therefore, we should intensify our campaigns, our teachings, and awareness with regarding cervical cancer. This is the best. There's a saying that says prevention is better than cure. Actually, prevention is better, prevention is cheaper, and prevention is easier than cure. It is better,
Definitely.
it is cheaper, and easier than cure. And this is where we are all tilting towards the area of preventive medicine rather than curative. Yes, any woman who comes down with cervical cancer, she will surely receive care and be managed. But most of our efforts should be directed towards prevention right now. And I believe that if we do this, we stand a chance of defeating cervical cancer.
All right. Thank you very much for that. So, what would you say to people who are let me call it caretakers of people who have this actual disease? Because a number of times people just focus on the just the patient alone, but then you see the family members are weighed down, they are distressed because this person is always in and out of the hospital. So what would you like to say to those kind of people? How, like, because it's not really easy for them to deal with as well, as much as the patient too is a
Mm,
an issue. It's like a burden on them, and at the end of the
mm,
day sometimes the patient doesn't make it, and then the family members are like, oh, after all the stress, everything, now this person still didn't, make
mm.
it. And yeah, so basically, what do you have to say to those kind of people?
Thank you very, very much. Managing cervical cancer is stressful. Stressful for the medical team, stressful for the patients involved, and stressful for the relatives, the loved one. It's stressful. Stressful financially, stressful mentally, and even physically. For those with relations or loved ones having um, or managing cervical cancer, the best we can tell them is to be strong, and we understand that it's challenging. Uh, our support, our prayers are with them because it's not easy. Sometimes you feel as if you are giving all this, you're giving all the money, you're giving all the time, and it looks like after I've done all this, yet there is no, or I still lost this fellow. You understand? So we know what it is. We know the pain. Even for the medical team, losing a patient with cervical cancer itself it's quite discouraging. You understand? Because we shouldn't have gotten here in the first place. What we tell them is they should also get more knowledgeable about cervical cancer. Sometimes you also don't need to get sad or angry with the patient, because sometimes it feels that we're doing all this for you. Are you not also supporting us? It's not easy for an individual going through this phase of cancer management, cancer treatment, chemotherapy, and the rest. It's um, quite challenging for the patient. So we understand, and our thoughts and prayers are with them, and we encourage them to remain strong and do not give up. You understand? That is the best we can do, and also seek specialist care at the very early stage. Seek specialist care. In this part of the world, we see people with these conditions. They go to different prayer homes rather than going to the hospital or seeking specialist care. I'm not saying you
Religion
should.
is not
I'm not saying you should not go for any prayer or
sure.
whatever, but whatever you are doing, I beg you, um, get specialist care. If you want to do your prayer, fine, you can do your prayer, but ensure that the right people are managing you, because it's painful. You see somebody with cervical cancer, instead of you going to the hospital, you are going to one religious house and you are drinking warm water. They say you should drink, or they say you should rub something on your body. Come on, at this present time. It's sad. I'm not saying you shouldn't do it, but what I'm saying is that
Yes,
in conjunction to what you are doing, ensure you get the right medical care.
yes, all right. Thank you for that. Because a number of people would say no, that they don't take medication, they don't go through medical procedures, they just pray. While it's good to pray, even the Bible says faith without works is dead. As they're having
Mm-hmm.
faith, there has to be
Mm.
works that are accompanying
Yeah.
it, and that work will usually be the treatment that you're doing beside it,
Yeah.
right?
Yeah.
So yeah, that's usually it. It's just like someone saying, oh, they want to pass their exams, and then they don't read, and then they just pray. Of course you won't, you're not, nobody is going to remind you what you don't even know, right? So usually, as you are combining your faith, you combine it with works, which will be the treatment of the whatever issue it is, the
Mm.
whatever medical issue it is. And then also another question here would be for someone who has been through, let me say, been through cervical cancer, and let's say survived it and is now in the aftermath part, right? How would I describe that? The person survived it, right, and is trying to pick up their life again and
Mm.
move on with life. Like, how are they able to manage themselves? Because as it were, perhaps in the really terrible stages of their illness, most of their life just came to a standstill and all of that. So how are they able to manage moving forward? And sometimes some people say that there's some form of stigma that comes with it, that people begin to behave somehow towards them and stuff like that. So how are they able to manage coming back up and just getting back to life and
Mm.
being generally vibrant again before the illness knocks them down?
Thank you. This is a very important question. For anyone who has gone through the phase of cervical cancer, the process, the management, and is out of it by the grace of God, my best advice would be to enjoy your life. You first of all enjoy your life, because only you know what you faced. You can't actually tell. Nobody went through that phase with you. You went through the process. This is why you should express yourself, enjoy your life, and do not live your life based on anybody's standard, number one, or do not seek for anybody's validation. I feel the reason why people stigmatize others, or the reason why we have stigmatization, is because of poor knowledge. When people don't understand a thing, the next response is fear and aversion. So people run away from what they don't understand. The more people understand that cervical cancer um, is not a death sentence, it's not something you have to transfer, or you can contact, you understand. I don't see any reason for discrimination. Anybody who has gone through cervical cancer should be celebrated, should be encouraged. And then for anyone too who has gone through this phase, the advice would be to follow up with the management, with the advice given to you by the medical team. You understand? These are very, very important, because we notice that some people say, I'm out, I just have to travel and live my life. Fine, it's good to live your life, but also ensure that there are certain advice you have to follow and keep up with, as given to you by your doctor. But once again, whoever has gone through this should be happy, should be confident and should hold her head up high without being scared or intimidated by anyone.
All right. Okay, thank you very much for that. So I'd like to ask the people watching if they have any questions. Any questions? I can't see any questions popping up. So I guess that people don't have questions. So if you have any questions, you can just drop them in the comment section and then we'll pass it on to our doctor and you would also be able to contact him as well. Um yes, so in summary of what we've been discussing today basically being about cervical cancer, which is abnormal cells in the cervix, and it's usually caused by the cervix is in between the cervix is in between the uterus and the vagina. So, cervical cancer is usually caused by the HPV vaccine. Sorry, HPV virus, the human papilloma virus, in which we have the most common ones as the type 16 and type 18, and this is more common to people who are sexually active. That's the women, ladies who are generally sexually active. They are more, they have more possibility of getting it than someone who is actually not sexually active. That's why the government usually brought up the issue of vaccination of young girls between 9 and 14 so that they can get vaccinated for future purposes and not have to deal with all of that in future. And then another cause of cervical cancer would be a woman who has multiple sexual partners. So one has to tone down on that so that the possibility of actually getting it would be reduced to a great extent. Another cause of cervical cancer would be smoking as well, which is a very bad lifestyle. A number of times, in as much as people have heard so many times, do smoking kills, it reduces the lifespan. You see people just going ahead smoking, it affects their life, and then many years into the future, they now, and when they are seeing the repercussions of their terrible lifestyle, they come on social media. Oh, come and help this person, come and help that person, donate money for this, donate money for that. While it's not a bad thing to support maybe someone's surgery, but if the person is the main cause of this problem, then it might as well be prevented other than having to now come and beg the public that, oh, come and pay 5 million or 10 million or 15 million for this person's cancer
Yeah.
treatment, when the smoking could easily have been stopped, right? And then someone with a weakened immune system is also prone to having cervical cancer than if
Yeah.
the person had a stronger immune system. And another thing that may cause cervical cancer can be multiple pregnancies, because that would mean more sexual interaction, sexual intercourses as well. And the stages of cervical cancer are the early stages and the late stages. Okay. Ooh, okay. I hope that one's saved because I just noticed it restarted. It restarted. I think we have exceeded 1 hour here, so it
Oh,
restarted.
okay.
Under the early stages of cervical cancer, we have the bleeding after sex, bleeding in between periods, or after menopause, like when a person has reached their menopause and then it still looks like they're still seeing their periods, then there's
Mm,
definitely there may be a cause for concern. And then the bleeding in between period that make it look like your periods are not even stopping, you're having your period ended maybe 2 weeks ago, and then instead of ovulating now you are bleeding again, then of course you would need to check that out. And of course, bleeding after sex is definitely a sign that is off. It needs to check that as well. And then okay, whether watery mucus like and or bloody or smelly discharges may also be a sign of cervical cancer, which needs to be checked out. Lower abdominal pain after sex as well. And then for the late symptoms, we have pain and bleeding while using the toilet. We also have swollen legs. Like there are sometimes you see people's legs are swollen, like way beyond the usual sign. There's
Mm.
definitely a problem. And then back pain, heaviness in the lower abdominal region. And then some of the preventive measures would be the use of vaccines, like I mentioned earlier, for the between the ages of 9 to 14, and then even older women may also be able to use it as well. So preventive measures as well would be to get screened, get to see a doctor. When you notice any of those things, you get to see a doctor, and then do your paps. I don't know why it keeps restarting. It has been restarting. Okay, so do the HPV test and then the pap smears as well. And of course, see a doctor if you have any issues. And then, of course, the treatment includes chemotherapy, radiotherapy, immunotherapy, and of course, surgery as well. Surgery to remove the affected organ so that it doesn't spread. That's for those that haven't already spread, because once it has spread, well, that would be a long story again. So, basically, I want to thank everyone that joined this live video. And then you can always reach out to Dr. Fred. His handles are Dr. Fredosta, like DOCTOR FREDOSTAR, right? Fredosta. Yeah, so
Yes,
Dr.
Dr. Fredo Star.
Yeah, so you can find him on Instagram, Facebook, Twitter, right?
Yeah, Twitter, I'm there, though not active on Twitter.
Very more active. Okay. So Instagram, Facebook, TikTok, right? Are you on TikTok as
Yes,
well?
yes, I am on
Instagram,
TikTok.
Facebook. And then if you find him on Twitter, you can also follow him as well. And then you can also ask him any questions you may have about the subject matter and any other medical thing, because he's a medical doctor with at least 8 years of experience. And then you can also ask him any questions you may have about the subject matter, and any other medical thing, because he's a medical doctor with at least 8 years of experience. It started again. And I hope you enjoyed the video. Thank you so much for joining. And if you're just coming, you can watch the replay. All right, so I wish everybody a great evening. Bye. Thank you, Dr. Fred, for
Thank you
gracing
so
this
much.
live video, and thank you for your time. Thank you for sharing your knowledge with us. And yes, we'll definitely keep in touch. All right, so thank you. Bye.
Thank you. Bye bye.